All right, today we've got quite a few different exercises to cover. We got a couple of compensations we're going to be treating. One will be a weak glute medius, a overactive piriformis, and then also the individual will relax dorsiflexion. So a couple of exercises we're going to just progress through each phase of the corrective exercise program. So to start with, to help aid that weak glute medius, we're going to inhibit the overactive adductors. So most of the time I like using foam rollers, but this is a difficult area to reach, kind of awkward to use a foam roller. It is possible, but if I have a hand roller, I'd much rather use a hand roller. Same thing, I can either stand or sit, whichever. Start distal and then work proximal, and pause just one set, pause for 30 seconds at each tender area. Just work your way up. This will be getting the adductors, gracilis, sartorius, and even probably a little bit of the medial hamstrings as well. So one set of that's going to be for the adductors. For the piriformis, I like using a denser foam roller. So I will sit on the foam roller, cross, this is the leg I'm going to treat, I'm going to cross it over so it opens up that hip joint, makes it easier to reach in and grab that piriformis and inhibit that since it's overactive. The more firm the foam roller, the deeper it will reach. And this is usually a pretty uncomfortable stretch or exercise to do. Again, pause for 30 seconds. And so I'm going to go from my PSIS down to my ischial tuberosity down here, and then back and forth, just once, twice, maybe, just for good measure. So that's for an overactive piriformis. And then for gastroc soleus, which we've done several times before, adjust your tension by crossing your legs over the other or just relaxing. And you'll start down in the Achilles and roll all the way up to the back of the knee where the muscle belly inserts. Again, pausing for 30 seconds where you are tender, and you can also work medially or laterally, whichever might happen to be overactive at that point. So one set, 30 seconds in tender spots with that. Next, we're going to move on to lengthening. So back to the adductor group. I'm going to lengthen this adductor group with the side lunge. Keep that chest up. Hands on the hips usually helps. So just 2 sets here. Hold for 30 seconds on each one. Really going to feel that pull on the inside of your leg there. And then back up. All right, next, the adductors as well. This will be a bilateral adductor stretch. We'll do it PNF style this time. So what I'm going to do is contract into my elbows. I'm going to put my elbows right here against my legs and then grab my feet. And I'm going to contract my legs inwards against my elbows for 7 seconds. 6, 7. And then I'm going to passively push my elbows down and just pull my knees downwards and stretch. It'll be uncomfortable, but stretch for 20 to 30 seconds. And that is PNF. So contract, about 25% contraction into my elbows, and then relax and stretch, using my elbows to assist my knees to go downward towards the floor. excuse me. And then piriformis stretch, the same as like a reform rolling, cross my leg over, and then I'll slide my heel up. And I'll just let that stretch. Sometimes it's more of a lateral biceps femoris or lateral hamstring stretch, but it also will get the piriformis here. If I need to, I can lean forward, make it a deeper stretch if I want. Again, 2 sets of 30 seconds with that. Back up, and then of course we have our gastroc and soleus stretches, which I've demonstrated before. I've got a hand board, so I like to use that. Straight knee for the gastroc, muscle belly. 2 sets of 30 with that, and then to isolate the soleus, I'll use a bent knee. Remember, push that heel down on the ground. Keep that on the ground. Don't let it rise up like this. We're not doing tippy toes. Keep that heel on the ground. Good. That's going to help increase the dorsiflexion, which the subject is lacking. All right, good. Now on to the strengthening. What we're going to do, all these will use 2 sets of 10, except for one, and I'll point that out. One for a weak glute medius, you can lay on the side, put a yoga mat down or something if your patient would like that. But you can either have a wall straight behind the person, or me, I just like laying on the ground or a table, and we're going to do glute raises. This is going to isolate that glute medius right here. And then as you watch them, don't let that foot come forward. You need to make sure they stay in line. So straight in line right here. So hold it for 2 seconds at the top. 4-second count on the way down. And you can go three sets of 10 to 15 reps, depending where they're at on the program. Or sorry, 2 sets of 10. And then that is for the glute medius. Next, let's see, where's that? We're going to do roughly a positional isometric bridge. I like using like a volleyball size ball. You can use medicine balls if their strength is a little bit more advanced, because it's more difficult to hold that weight there. I've just got a pad for now. So I'm going to put this right between my knees. I'm going to have to contract inwards to hold that pad there. So that's working my adductor group. And I'm going to do this for 25% contraction, 50, 75, and 100. So just one set through it all with contracting and holding this here. It's also going to isolate my glutes too. Just a 4-second hold, 2-second rest, up, 50-second contraction here. Good. 2-second rest, 75 contraction here. Rest, and then 100% contraction. So once they start squishing, this is a fairly soft pad. Once I start to squish that too far inwards, it's time to move up to probably to a more dense ball or whatever you're putting in between the legs. And then to help isolate the adductor group, and do some bands. You can also do cables. There's many various items which can utilize this same procedure here. Most of the time it would be closer to a wall, but for me, I'm going to have my left leg planted. I'm strengthening this right adductor group, and I'm just going to cross over, hold for 2 seconds, and let it return. Make sure I keep my balance. I head up, shoulders straight and forward, contract, 4-second return, good. And then 2 sets of 10 of that. Now on to the more challenging integrations. Alright, let's start with a simple lunge. So to start tying everything all together. So knees over the toes, shoulders back. I've got some good dorsiflexion there, so that's going to help out my lunge. I can do this alternating if I have issues on both legs, bilaterally, if you will. And make sure knees over the toes, don't let that knee fall inwards or too far outwards. Make sure you're keeping an eye on that. It's helpful to do this in a mirror. You can just watch yourself. Alright, now single leg step up. And then, well, also known with a toe touch, or a heel touch, sorry. And an overhead raise. So I'm going to step up, reach overhead, step up with an overhead reach. And you don't have to pause, it's better if this is all continuous because it really starts to engage that core. So then you can do these exercises as you need for 1 to 3 sets, 10 to 15 reps. You want to make sure they're nice, slow, and controlled to make sure you really re-educate that neuromuscular coordination. Good. Next we have the RDLs with an overhead raise. So it's a little bit more difficult. Down, overhead press, regain the balance, bring the weight back down, reach down to the floor as far as you can, slight bend in the knees, okay, and then reach up to an overhead press, down, and then back up to an overhead press. So, and it's dangerous if they start swinging that weight around too much, just like this. You don't want that, you want it nice, slow, and controlled. Just like that. Alright. And then one of the evaluations would be the single leg reach or single leg balance test. It's also good for rehab and strengthening and integration exercise. So we'll pretend that I have a line forward at 45 degrees to the side and posteriorly reaching behind. So I can reach, do a heel reach forward as far as I can, back up, make sure that knee goes over the toe. This is a good one to measure as the program continues. It's good to be able to see